Right, Mr. Singh, if you could tell us about the current projects of Fortis.
We are building a few hospitals currently. One is Fortis La Femme. This is an all-women's hospital with birthing and neonatology at Ludhiana. We've just completed a hospital in Richmond Road, Bangalore. This also is a La Femme, which is focused again on women and birthing as well as neonatology. The third one is a major expansion, more or less the doubling of a capacity of our large super specialty hospital at BG Road in Bangalore, where we are expanding it by about 225 beds and building a cancer center. And the last one is a hospital in Chennai, which is now ready. It's a 200-bed super specialty hospital at Arcot Road, and once permissions are in hand, we intend to launch it over the next few months. So those are the projects which are currently underway. Apart from that, there are a number of internal expansion projects that we are setting into motion later this year. So this is really an ongoing program for us.
That's great. What are your thoughts on Swasth Bharat taking us to Sabka Vikas?
I think Swasth Bharat is a fantastic program. It seeks to change the cultural mindset of every Indian. I believe that a lot of good work, especially in terms of building toilets, etc., is happening pretty well in the hinterland, in the villages and the smaller towns. However, I think the program hasn't quite gained traction in larger cities. So in Delhi, for example, or Gurgaon, I see no impact. I think there is talk about it, but there aren't any programs which are actually beginning to see the light of day in these big cities. And perhaps government could consider taking up small areas in these big cities and making a difference there and making them as an example of what is possible, rather than boiling the ocean. Take up small territories, create a program, make it succeed, and create excitement around that is the way that I would like to see it happen. But I think the time is still short. We hope that we will see a lot of action.
Right. What are your thoughts? How do you think we can bridge the gap, the rural versus the urban?
I think that's a very difficult question. Having said that, there are mechanisms to do this, and the idea really is that bulk of our population is in the rural areas, in the very small towns, and these people do not have access to good health care. So first and foremost, I believe that the government schemes of providing insurance to every Indian, and more specifically every poor Indian, is a very important first step. The second step is that this will enable private players to set up facilities in the smaller towns, because people will then have an ability to pay for health care. The challenge that I really see is that unless there is an adequate supply of doctors and nurses, we are going to find very few people who are willing to go and work and serve in these areas. So capacity building in medical colleges, nursing colleges is an absolute must. So I see it as a very slow process. In the meantime, I believe that technology and remote care can be two very important enablers for providing care to people in those areas.
Is there any involvement of Fortis in the rural areas?
Only from a CSR point of view, yes, but not. We don't have any hospital there because it will be totally unsustainable, really.
Right. If you could tell us more about the CSR initiatives.
So CSR initiatives, we have a number of them. One of them is that we adopt a village and work around creating better infrastructure, especially in the field of education, health and hygiene. That's one domain that we are working on. The second aspect of CSR is that we also serve a lot of the poor children in terms of their heart diseases. So for example, in the last 1.5 years, we have done free cardiac surgeries for more than 400 children in collaboration with Being Human, which is a charitable foundation by Salman Khan, and it's a collaboration between Being Human and the Fortis Charitable Foundation. And that is a huge amount of good work that we've done. The third major area that we are actually focusing on is a program that we call Seva, which is to respond during national disasters. So, for example, last year in the month of October, there were floods in Srinagar. Over a period of 2 months, we sent 6 teams from our various hospitals to provide emergency medical treatment to a lot of people, and I think thousands of people were actually covered. More recently, post the Nepal earthquake, we sent our team, which has just come back last week only, after serving there for 3 weeks, and they treated again several thousand patients who were in need of basic care. So we are beginning to engage quite significantly on many of these. Apart from that, we do a lot of other CSR programs, but these are our significant CSR programs that we engage in.
Well, now with the FDI in healthcare, any competition you're facing?
Not really. I mean, competition in the sense that we do see small entries of various players. I think the most recent entrant has been IHH, which owns the Parkway chain in Singapore. I think they have acquired some hospitals in the country, and I think it's good that they are coming in because it will lead to an enhancement in quality, infrastructure, and the systems of doing care. I think there are too few large corporate players in our country, and if more people are willing to invest in India, then it will develop the healthcare market and sector of our country. It's going to be good for us.
Mr. Singh, you having such a great experience, what would your solution be in order to go ahead and take care of the major challenge of healthcare, that being accessibility and affordability? How can we tackle it?
I don't think there are any quick solutions to it. I do believe that there needs to be a very, first of all, healthcare needs to be a high priority agenda item for the government of the country. And my frank opinion is, I don't think it has yet taken that place. That needs to happen. From there, I think everything else will flow. But I do believe that a very meaningful dialogue between the private sector and the government on the same table will lead to creation of a very vibrant healthcare sector in our country. Because all said and done, the healthcare sector requires a huge amount of capital inflow. I don't think that the government has the means today to fund the creation of that infrastructure or to invest funds in it. And the viable route to taking this forward is in close partnership with private players, small, large, it doesn't matter what. Private doesn't have to be large players, it can be anybody who's doing private practice. How do you enlist the support and active participation of the private sector in providing larger public good? I think that's really the question that we need to address. And there need to be perhaps work sessions, brainstorming sessions to come up with a plan that the larger ecosystem of healthcare subscribe to. I think that dialogue is necessary.
Right. We would be the most populous country in the world by 2028. Where do you see Fortis there?
In which year?
2028 as per UN, United Nations.
Well, I think we are going to be a better organization, a larger organization. Better, I mean, in terms of a greater focus on quality, on clinical outcomes, in doing, in driving clinical excellence and patient care to an even higher level. That's one. And number two, by that time, we should have a greater presence and be touching very many more lives than we do today.
What is the extent of technology usage in terms of data, cloud and analytics Fortis is using right now? Well,
today we are very technologically savvy, so we are working on the cloud. We have a very good IT system, which really does, it's an ERP, Oracle ERP, that manages the entire financial and transactional data for us. We have got some very powerful HISs which are operative, and we are trying to create a unified HIS system which will provide us even better care. So technology is going to be a very, very major enabler for us, and our our Gurgaon hospital was adjudged to be the second most technologically advanced hospital in the world by an American research group last year. So it is simply telling you the direction in which we are headed. So technology is really in diagnostics, it is in treatment, and it is in managing processes. And I think in all three domains, there's a huge amount of focus that's taking place in our organization. We are using technology even to take care of patients in remote areas. So we run a program called the eICU program, which really means that our specialists sitting out of Delhi today are managing ICU patients in approximately half a dozen centers very far away from Delhi, where we don't, where we cannot get intensivists to be there. And that's a great proposition because patients don't need to come to Delhi. However, we can reach expert advice to them from Delhi
And they
by
serve
the
that,
top doctors,
and
it works in a very cost-effective manner.
Cost-effective, yes.
So it's
They
really
save that
leveraging technology
transportation
to make
cost.
it happen. Yeah.
Great. That's the last question here. Few do's and don'ts for startup entrepreneurs in the healthcare space.
Do's and don'ts. Well, I think number one.
Because now we do have startups coming in the e-retail and
Yeah, so
e-commerce.
I think startups will happen where people see possibilities. A lot of people see problems, but the people who are entrepreneurs see possibilities. And I think it's a good thing that this is happening. Having said that, it's important for entrepreneurs who are moving into newer models, newer startup spaces, to do their homework very diligently.
For the healthcare sector.
For the healthcare sector, to understand the risks associated with their business model, to run a proof of concept before scaling up very large. I think proof of concept is you set up the model, you make it run, you perfect it, and you make sure that it is actually a sustainable proposition. Once you figure that out, then ability to scale up and replicate is much easier.
So overall, it's a good time for startups to come to the healthcare sector.
Absolutely, because I think India cannot follow the traditional route of just creating infrastructure the way the West has done. We don't have the time, we don't have the resources, and therefore we need to leapfrog and leverage technologies and unconventional solutions to provide healthcare to our masses. That's probably the only way India can move forward, and there's got to be an India-centric model. I think it's going to be very exciting times, and we need to do more of that.